Good morning, everybody. We're back again for the Friday morning source. I'm here with Kathy Montgomery with the Williamson County Department of Health. Good morning, Kathy.
Good morning, everyone.
So tell everybody a little bit about your role for the county.
Okay, I am the County Health Director here at the Williamson County Health Department. I've been in this role almost 7 years. Prior to that, I worked for the Florida Department of Health for about 13 years. And when I first came to Williamson County, I'm a Tennessee resident previously, and I worked as a health educator here before I stepped into the role of County Director.
So we have a lot of questions that we want to talk about what the county health department is doing. I think the big thing that people are really concerned about is testing for COVID-19, and you guys are offering that for free. Can you tell us about that?
Absolutely. Yes. We currently have testing available at our Franklin Clinic at 1324 West Main Street, as well as our Fairview Clinic, which is 2629 Fairview Boulevard. We offer that testing daily, Monday through Friday from 9 until 3. It is free to the public. And this weekend on Saturday, tomorrow actually, we'll be offering free testing to the public from 10 until 3 at our Franklin site on West Main Street.
So tell us how that testing worked. Do you get out of your car? Is this a drive-through type testing? How does this work?
It is a drive-through. That's correct. So individuals will just stay in their vehicle, and a nurse will come up. They'll complete an assessment form, get your information, regardless of how many people you have in your car. They'll come up to the vehicle, complete the assessment, and then just do the nasal swab. We've been really fortunate at working with 2 laboratories right now. And so we've been really fortunate to have testing results coming back within 24 to 48 hours. This weekend, all local health departments around the entire state will be offering a testing site either on Saturday or Sunday. So if you have neighbors, friends, relatives in other counties, they can go to tn.gov to look for where the testing site is going to be located in their community.
So tell me about, do you need an appointment to come for the testing, or can you just drive up?
No, ma'am, you can just drive up anytime, Monday through Friday. There are signs that'll direct you where to go. Right now, we're offering the testing in our Franklin Clinic behind our facility. So we have tents set up, and just pull in.
So who should go get testing? Like, what type of symptoms should you have, or should you be presenting to go get that test?
Well, in the past, what we were instructing individuals to do is if you had symptoms such as fever and cough, shortness of breath, or difficulty breathing, definitely try to come in and have tests done, or go to your local provider or walk-in clinic because they're doing testing as well. Right now, they've relaxed the the symptoms, so to speak, and allowing anyone, whether you have symptoms or no symptoms, to go ahead and come on in for testing. So.
Okay. And then since we're talking about testing, how will people be notified of their results? Will you guys give them a call or email? How does that work?
Absolutely. So if you're having a test done at your local provider's office or the walk-in clinic, they'll definitely be calling you with your test results. Here at the health department, if you have the testing done here, we have folks that have been trained and cross-trained on contact tracings and so forth. So they'll be calling you to let you know what your test results are. Now, if your test is negative, obviously you're going to get a phone call. If your test is positive, obviously we're going to be calling you to let you know that it's positive. But even if you got tested at like a local provider or walk-in clinic, those positive results do come to the local health department for contact tracings. And when I say contact tracing, that means that we'll be calling the individual that tested positive. and gathering some information from that individual. For example, who lives in their household, where are they employed, uh, who they've been in close contact with over the last 48 hours, for example. So that means, and the CDC really defines close contact as someone that you might have been in contact with for greater than 10 minutes and at least 6 feet. Okay.
Gotcha.
So what we'll begin doing is we'll begin calling those individuals to let them know that they may have been in contact with someone who is COVID-19 positive, and ask them to go ahead and self-isolate for up to 14 days and just assess their symptoms to determine if they too are having symptoms, then come in and get tested.
Okay, that you've kind of answered this other question I was going to ask. What should we do if we think we've come in contact with someone who has COVID-19? Should we go ahead, if we've been in contact with someone, get a test, or should we go ahead and self-isolate? Would that be the same advice?
Yes, ma'am. Yes, ma'am. Go ahead and self-isolate. And if you want to come through a testing site, regardless of whether you've had symptoms or not, you can. You can come to any local health department. And just to know that if you don't live in Williamson County, or if you have relatives, you can go to any site. Most health departments are offering free testing from 9 to 3 during the week as well.
So even if you're not a Williamson County resident, you're free to use this free testing site. That's correct?
That's correct. Yes, ma'am. We're not turning anyone away, regardless of what county of residence you're in. You can come to the Williamson County Health Department.
That's really great information. I think the other thing to note too is that you guys, in addition to offering this COVID-19 testing, you offer other services for people who may have recently been furloughed or lost their jobs. Can you talk to those other services you have?
Yes, ma'am. Absolutely. So on a daily basis, the health department, offers services like primary care, WIC. We actually have dental services as well. We have a full-time dentist here on our staff. Um, and so right now what we've done is we've kind of minimized the services so that we can obviously focus more on our COVID-19 activities, but also we're trying to eliminate people having to come in through our clinic. So for example, if patients are calling, they need medication refills, things like that, we're trying to keep them in their vehicles and offer that curbside service to deliver their medications. If they're calling for death or birth certificates, we're also trying to run those out to the curb for them. Our WIC has been probably the most phenomenal. We went to a new electronic EBT card several months ago, which allows food packages just to be uploaded to the EBT card for our pregnant, postpartum, and breastfeeding moms, or with any mom with a child under the age of 5. And so what we've been able to do is just do phone counseling with them rather than them bringing their children in and maybe exposing them to some virus. So we've been able to do that and upload their food packages on their card. So that's been really, really wonderful. And I really encourage that if there are individuals that have been furloughed, lost their insurance, lost their jobs, and even just need to access some of our services on a temporary basis, we encourage people to please call the health department to see about how they can access those.
Yes. So tell me how people can get in touch with the health department if they do need those services or have a
Yes.
question.
If you want to, you could call the Franklin Clinic at 615. Oh goodness, you caught me off guard there. 615-794-1542. Or if you live closer to the Fairview community, you can call 615-799-2389.
That's great. Well, I think we've covered everything we wanted to talk about today. I really appreciate all the hard work that you guys are doing there. I know you're super busy. You were just telling me you're on phone calls all day long, trying to get all this situated and taken care of for our community. So we really appreciate it.
Thank you so much. I appreciate you guys allowing us this opportunity to talk today. And I just want to tell everyone, please continue to social distance and stay well.
All right. Thanks so much. We'll see you soon. Bye, Kathy.
Thank you. Bye bye.